Hey everyone, so today we're going to talk about hip injury inducing mechanics in the golf swing that are common to see, common to find, swing characteristics that lead to hip pain. So to go over that, the main ones we're going to go over are going to be related to square feet, stance width variations if you are too wide apart, too close together. If you have the right hip high, if you're a right-handed player, if you have S posture, which is this guy right here where you're overextended through the low back, if you sway or if you slide in your swing, or if you hang back, or if you try to straighten the trail leg. That didn't feel good right there, doing that. But, so all those things are going to lead to hip injury, hip pain. And those are going to be inducing or causing mechanics of hip pain in the golf swing. So first up, square feet. If we're so focused on having absolutely square feet, that might not be the best option for you, because what happens is that you're going to be limited with how far you can rotate if you already have a mobility problem in your hips. Now, if you already have a mobility problem in the hips, it's important to get that looked at if you haven't already had that looked at, because that's something that likely, more than not, can improve and get better. So, and it's going to be important to get that better because that's going to directly relate to low back pain. The number one predictor for low back pain is having not enough mobility of internal rotation in the hip. And so, square feet could be a problem. Stance width variations, if you're too wide, it's going to, the reason why the stance width can lead to problems in the swing is because of the tendency of people to want to move with it like this, right? So a lot of lateral or side-to-side motion is going to lead to a lot of closing down of the joint, stretching of tissues, closing down on the joint. We don't want that. So it doesn't feel good. Go ahead and try that if you're able to. Try to sway side to side a couple of times, and if you do it fast, it's not going to feel good. It's because you're really packing into that joint, and we don't want that if we already have an irritated joint or not enough mobility. So that's stance width variations. If we're talking about hip high, and so for the cue of having that right hip high here in the backswing can cause some issues because for a lot of people, they don't have enough mobility to be able to withstand the amount of force that they're going to be putting into that hip if we keep it really high. Now, ideally, do we want that to be very high? It's going to be dependent on the philosophy of the instructor, but relatively, if you're going to be, we want to have a swing that fits your body and your mechanics. And so that's going to be what's important there. S posture. If we're here and we're stuck in this extended position, we're really going to be cranking on things. Go ahead and go here and try to turn in your hips, side to side. It really restricts the amount of motion because we've tilted the pelvis and closed down the space of that hip joint because we tilted the pelvis. So we've already limited how much rotation, how much movement we can go through because of how we already set up. We don't want that. That's defeating us before we even take a swing. So that's a common hip pain inducing mechanic. Swaying and sliding. Those are going to be big ones. Very, very common. And so we're swaying away. Here, and especially if this is staying down, we're kind of closing into this joint. We're closing into this joint, stretching tissues. And then if we slide, goodness, that's going to cause some pain. So why do those things happen? Because of possibly not enough strength to do what you're trying to do with your swing. You might be trying to help the ball a little too much. You might not have instruction could really help with that, technique based. But often it's going to be because of mobility restrictions or mobility problems elsewhere in the body. And so that's going to be important to get looked at. But swaying and sliding are going to also be distance killers. They're going to be consistency killers, and they're not going to make you feel good either with your hips or your back. Hanging back. So right-handed golfer, hanging back, we're going to get into our downswing and we're going to try to help the ball. It's a common thing. And right here, if you try to do this, if you stand up and do this right here, you might feel a lot of pressure, maybe some achy, maybe a pain by doing that. Now do it fast in your swing. Oh, it does not feel good. And so that's going to be something that likely needs to get cleaned up with instruction, with proper golf instruction to prevent that hanging back phenomenon that we see. But it's also going to be related likely to mobility problems and strength problems as well. And lastly, straightening the trail leg. So if we're straightening the trail leg, and this can either be in the backswing or on the downswing, again, we're talking about a lot of load into the joint that might be excessive. We don't need to go necessarily to these end ranges and locking out the joint because that little knee flex takes quite a bit of stress out of here. And so if we lock that out, it's not going to feel good because a lot more of that stress that could have been helped by lower down the body is now going to be taken up the chain to the hips. So with that, those are going to be the common injury-inducing mechanics that we'll see, swing faults that we'll see. But with all of that, make sure you get assessed. If you haven't been assessed before, if you're having pain currently, give us a call because we want to help you get out of pain, make sure you're able to play golf for years to come, and make sure we give you a clear path to get you to where you want to be.